This is Sarah Baroni, and I am doing my skills validation for a closed chest drainage system. I have all my supplies printed here since I don't actually have access to them, and this is going to be for my critical care term. So I have a new closed chest drainage system kit. I have the hemostat, you're going to need two. A pair of clean gloves, a mask, chucks, so that way in case water or you have any kind of leakage, you can lay that down, and then extra tape in case it gets messed up from here, from the patient's side, or you need to retape anything there. So first we're gonna go ahead and do our pre-procedure checks. So we want to perform hand hygiene, knock and introduce ourselves, and identify the patient using two identifiers, so name and birthday. You do want to ask the patient if they have any allergies and perform your environmental checks. So make sure that there's no any kind of safety hazards in the patient's room. You do want to make sure the bed is positioned in the lowest possible position, make sure the brakes are on, and you want to do any kind of patient education that needs to happen, explain the procedure, answer all of the questions that the patient might have. You're going to gather all of your supplies and verify your doctor's orders. And then make sure that you provide privacy for the patient. And so first we are going to come in, wash our hands, and we are going to put on clean gloves. We want to observe the chest tube drainage system that the patient already has in place. And what we're looking for is in chamber C. We need to look to see if there is an air leak in here, because if there is, we won't be able to clamp the chest tube. So we do need to check this before we change it out to a new kit. So we then want to raise the patient's bed, and we want to remove the outer wrap of the drainage kit that this new one is going to be in, and make sure you're opening it away from yourself, keeping everything clean. It's going to be in like a package, and you can open away and then towards yourself. And then you'll go ahead and remove this new kit that you have inside of your packaging. And there's going to be on the back of this, there's going to be a tube of water that you're going to need to place here at the top. There's going to be a chamber, and you're going to squeeze in all the water or all of the fluid into chamber C until you hit the 2 centimeter mark. So while you're doing this, you want to make sure that you can't see anything wrong with this new filter system, that the chamber is actually filling. There is a 2 centimeter mark on chamber C, so you'll be able to fill the water until it hits C. And we're just making sure that there's no discrepancies or anything wrong with this new chamber that the patient is going to be set to. And then you're going to remove your gloves and wash your hands. Then you're going to put on a new pair of gloves as well as a mask. What we're going to do is take that tube that's connected to the patient's chest and get our hemostats, and we're going to clamp that tube. But we need to do it so that the clamps are like this. So you have one clamp going this way and one clamp going this way to ensure that the chest tube is actually clamped off. They need to be opposite from each other. And then you're going to disconnect from the bottom of this chamber. You're going to disconnect the tube from the old one and put it onto the new kit that we just set up. And then what you'll do is you'll take these two hemostats and take them off of the chest tube to allow for it to work properly and make sure that it's going to ensure proper sectioning from this chest kit. And then you'll take your old kit and discard it per your hospital or your facility protocol. And what you want to do is position the new chamber on the side, like towards the bottom. There's like a railing on the bed towards the bottom, and you want to put that at the patient's bedside and ensure that it's secure on there so that it doesn't pop up. And then you want to make sure that all of your chambers are working properly. And then chamber A, you can kind of change the setting on that depending on what the doctor has ordered to make sure that it matches the doctor orders. You want to make sure that there's no like improper bubbling where there's not supposed to be. And then you will make sure that the patient is okay, that they're comfortable, and you want to make sure that the call light is within reach before you leave the patient's bedside. Make sure the bed is in the lowest position possible, and make sure that they tolerated the procedure well and that you do in fact know that this chamber is working properly. It's set to the proper settings. You'll discard all of your old waste products in the proper bins per your hospital protocol, and then you will document the patient's toleration to the procedure and what you did. That way they know, whoever's working the next shift knows that this has been replaced and it's working well and the patient tolerated the procedure well. As well as I would document what settings you left here. That way they match the doctor's orders, and you did your environmental checks before you left the patient side. After discarding everything, you wash your hands again, and just document that procedure to make sure that the next nurse knows, and all the healthcare providers can see that. And that's going to be the end of changing the dressing on the chest tube.